Hello and welcome to this special conversation with Dr. Malaraj, one of our best gynecologists, and a lot more. But in this case with me, I want to specifically focus on sport a little bit and ask her about, reproductive health, how young mothers, how young athletes who, these are questions which have been dominant in our psyche for a while, but unfortunately we do not have expert advice. Dr. Raj, welcome to the show. If I can start with this, we are seeing a lot of young mothers perform in the sporting arena these days. Take a Sania Mirza, take a Bisma Maroof from Pakistan who's dominating the Women's World Cup. Your thoughts on, women's reproductive health and sport and the correlation, how young mothers can excel. A few words on that, please.
Yeah. See, of late we are seeing, as you rightly said, many young mothers are excelling in their sports. In fact, it is a very nice thing because many a times there are two point of time in their life they give up their sports. One is like when they come to the 10th standard or the 12th standard because of their studies, the sports take a setback. And second, after marriage, again they are not able to pursue. But then of late we see like Sania Mirza and others whom you have quoted, they are able to pursue both. Like in spite of having a baby, they are able to continue with their sports. That is really phenomenal. Because what I really understand is that because these young girls, they have quite a lot of determination and they've gone through quite a lot of struggle to reach that point in their life. So they definitely know how to balance all of this. That is both motherhood and their sports curricular activities. In fact, I have two daughters. Both of them are into sports. In fact, my elder one is, she has done her medicine and she is a national and international level skater. In fact, she's got even 166 gold medals, and right now she is in the India team for the international world. Which is going to be held in USA. And the younger one who's pursuing law is again a squash player who's also represented our country. So I know how it really works, what it takes on them to, to balance both of these academic and sports and come up to one point of time. The elder one, in fact, is also married. She's married to an Indian cricketer, Sandeep Warrior. So it is like now the next phase is like she has to become a mother and carry on. But then now she has her World Cup, so she's just wanting to finish off all these things. But then that is there in the next pipeline. Okay, so but what really inspires me is these girls, they struggle a lot to come up to this stage. They sacrifice a lot and they are quite disciplined, because without the discipline, it is not possible to achieve all of these things. So at the same time, if you see, the body also has to cooperate, but then they are constantly working with their body, be it the general health or the reproductive
system. That was my next question. That from a medical standpoint, can you please, for any aspiring sports person, obviously you have to balance both, right?
Yes.
So you have to balance health, you have to balance motherhood, you have to balance career. So if somebody wants to pursue sport as a career, your thoughts on that and how important can that be from the aspect of mental health also? Because it's also important that you be in a happy frame of mind. So reproductive health, motherhood, mental health combined, your thoughts on that, please, ma'am.
Yes. So first, coming to the mental health, they go through a lot of stress because there is so much of competition. So they are able to juggle all of this and able to maintain a stable mind. So that is really phenomenal, and they know how to take in failures and immediately, jump back to normal activities. So they are able to bounce back to their routine immediately, even if they lose any kind of an event, and then they are into their mainstream again. So that is one thing which I have really noticed, that amount of mind frame should be there in all these girls. And when it comes to reproductive health, again, it is the biggest challenge when they have any kind of an event coming up during their menstrual cycle, during their periods. So again, so basically what I understand is that they are able to even maintain that bit of it because they know how to handle that. There are many times, even when you see in practice, people, the girls give up their their normal activities, even going to school or colleges during their periods when they have pain. But then these girls, they are able to adjust. They know, okay, this is only a part of life, and they do not stop any of this. Maybe they may take some rest at that 1 or 2 days, and then they are able to get into their normal thing. But most important thing is they have to take care of their reproductive health as well. Make sure their cycles are pretty normal, and also, the flow is quite all right, so they are able to take part in all the events without any interference.
Thank you.
Thank you so much. Yeah, thanks a lot.
To make this comeback, the last comeback must have been the hardest with the child, with all of it. I mean, to be able to even do that, how tough was that? And I remember going to your house, having a chat, 26 kilos, shedding 26 kilos and all of that. How difficult was it?
Yeah, it was. I think physically, of course, it was difficult. That's, a no-brainer because of, losing the weight is only one part of what you're trying to do. Then you have to get strong again. And then you have to train to become a professional athlete all over again and teach your body what to do again. And then you have to try to win and be the best and be the best version of yourself. So it was definitely very hard, but also it was emotionally hard because thankfully I had no postpartum, which was great. And I think one of the reasons for that was because I started exercise really early after I had a son. And I can't say this enough, women need to, right after they have a child, a couple of weeks later, whenever their body is ready, they need to go, because the hormones that are released, it just makes you so happy. You feel worthwhile. You don't feel like your existence is only because of the child. You still accept because everything becomes about the child after. So when the child is born, the mother is born, but everybody forgets the mother and everything's about the child. So those 2 hours were my sanity. They were my space where I used to go. I used to work out. So I think those kind of things were difficult to deal with emotionally as well. You're going through a lot of hormonal changes. You're seeing your body change. There are a lot of things. And then the demands of a newborn, waking up like 8 times a night, and you're feeding, and I myself was feeding. So it was a lot. It was a lot. And definitely I think it was probably the hardest thing to do.